This month on the Taboo Topics podcast,
Women will suffer with itching, scratching, burning for a long time, and they won't tell anybody. And then, oh my goodness, ladies, you love to go to town down there with a harsh antibiotic soap and a big old scratchy washcloth. And that is just bad for the vulva.
Welcome to Taboo Topics, where host Mary Frances Emmons tackles awkward medical questions with Orlando Health's top health and wellness experts, getting the answers you've been searching the internet to find. Submit your own questions by emailing the letter r-podcast@orlandohealth.com or leave a 5-star rating with your question in the review section. This podcast is produced and sponsored by the healthcare leaders at Orlando Health.
welcome to Taboo Topics, where we address embarrassing personal health questions and try to take the stigma out of those discussions. I'm your host, Mary Frances Emmons, and today we're talking about taking care of your vulva. My guest is Dr. Shelly Seward, a gynecologic oncologist with the Orlando Health Cancer Institute. Welcome to Taboo Topics, Dr. Seward.
Thank you so much for having me.
So first, tell us about your work at Orlando Health and why we should talk about the vulva.
So I'm a gynecologic oncologist, and that means I take care of people with ovarian, uterine, cervical, and vulvar cancers or high-grade dysplasia or other changes on the vulva. It's important because nobody talks about it. It's that dirty little area down there. I just recently gave a talk where I was sitting next to a breast medical oncologist as well. And they said, who is checking their breast once a month? And everybody in the room raised their hand. And then I kind of cut in abruptly and said, who's checking their vulva once a month? Crickets in the audience. Not a single person raised their hand. And some people looked confused, like, what is the vulva and why should I be checking it? So I very much am glad you invited me here today to talk about this because I think it should be talked about more.
So I would guess that most people think they know what a vagina is, but are they really talking about the vulva, a word that not everybody does know?
And that is correct. So the vulva is the skin that meets up with that inner edge of the vagina, that inside tunnel mucosal layer. The vulva is mostly covered in squamous cells, more like the outside of your cheek, not the inside of your cheek. And it's that tissue, and there's no delineation really of the outside of the vulva. So it goes all the way from that inside vaginal margin outside to encompass your anus, where your stool comes out. It can go to the gluteal folds, or what people call their butt cheeks, even onto the inner thighs. So we take care of all that area, including the mons, the area north of the vagina that's usually covered with hair and goes all the way up to the pubic bone or the abdomen. So the vulva is a place that's covered by your underpants for the most case, and we're the people who take a look at that. So GYN will follow that.
So what are some of the most common issues that women confront with their vulvas?
Well, the biggest thing is nobody pays attention to it, right? And that's terrible. What they say is, oh, I had all my babies, I had normal pap smears, I don't need to see an OB/GYN anymore, right? I'm done with the OB part. But all women should have an annual exam. Doesn't mean you need a pelvic exam, but you need to be talking to an educated provider about your GYN situation, which includes the vulva. Because again, you can have lots of changes to the vulva, starting with pre-cancerous dysplasia or a non-cancerous upfront, but can turn into a cancerous change called lichen sclerosis, etc. It's that itching, burning, scratching thing. But we can notice some of this before it gets to the itchy, burning, scratching stage if you get an annual exam. Also, you should be looking at your vulva because you should know it better than anybody. The problem is as we age, we have other changes that makes it hard to see our vulva, right? Sometimes if you have hypertension and you try to bend over and look at your vulva, you get lightheaded and dizzy. Sometimes if you have arthritis, you can't bend your neck enough to be able to see down there, even with a mirror. So it's important, one, don't neglect the vulva. Make sure you or a trained professional are looking at it so that we can find early changes rather than late changes.
So is there a specific technique? You mentioned a minute ago a monthly exam, and, we all grow up learning how to do that with the breast. Is there a specific technique for examining your own vulva on a regular basis, or just take a look?
Exactly. It's about taking a look and taking a feel, because sometimes you can't see lumps under the skin, but you can feel them. So you just want to take your hands, feel all around that area, feel if something is unusual or new or different. You're going to have some lumps or bumps on the vagina because it's normal. You'll have thickened fatty tissue on that outside labia majora, thinner tissue on the inside labia minora. You can have sebaceous cysts, which are kind of like big pimples down there in that area. You can have hemangiomas, those little kind of blood vessels under the skin that you might have on your legs. You can have varicose veins on your vulva. As long as it's the same as it has been and it isn't changing at all, it's probably okay, especially if a provider's seen it within the year. But yes, taking a gentle feel, making sure you're not noticing or feeling any lumps or bumps or changes, and taking a look with a mirror over all that tissue, starting at the bottom of your abdomen and going all the way down to those butt cheeks. If you can't see inside those folds, gently open them with one hand and use the mirror to see the other area. But again, it can be hard. That's why we recommend a professional see it at least once a year.
More on this after the break.
This episode is brought to you by the healthcare leaders at Orlando Health, where we deliver the future of medicine today. Orlando Health. Choose well.
So a lot of us might think of the vulva in terms of sex or reproduction, if we think of it at all. But this area includes the urethra and peeing too. So is there special care or special examination, things to look out for in that region?
Correct. And so that's when we're saying opening the folds and taking a look at all of that area around the anus and around the urethra where the urine comes out. If I had $1 for every time I hear the story about where I was sent to the urologist because I had microscopic blood in my urine, but it turns out the blood wasn't coming from the urine at all. It was coming from a light little lesion on the vulva right next to the urethra that they only see when they wipe after going to the bathroom. And their problem all along wasn't the urine. They didn't need to see a urologist. They needed to see a gynecologist. So that's how important it is to make sure you look, make sure you know it, you're familiar with it. So if there is something different, you can say, hey, this is different.
So a surprising number of women are pretty in the dark about orgasms. Does the vulva play a role there?
The vulva itself doesn't, but the vulva houses your clitoris. Your clitoris has more nerve endings than anywhere else in your body, arguably even more than the very tip of your tongue, which if you've ever bitten your tongue, you know that's pretty darn sensitive. So yeah, if you have age-related changes, which are normal, you can get scarring of the tissue over the top of the clitoris or the clitoral hood, so it could be harder to get to the clitoris and harder to have an orgasm. You can also have lesions that make it not want to be touched, whether they're cancerous or precancerous. So yes, the clitoris is part of the vulva and important for sexual stimulation. The other thing that's important is the vulva closes in front of the vagina. So if you're going to have intercourse, sometimes when that skin is a little thinner or more easily irritated, you need to make sure you reach one hand down, open the labia or the outside vulva, and allow entry into the vagina without too much scraping of the penis along the vulvar folds. I explain it to women like this. If you're going to park the car, you want to open the garage first. Otherwise, nothing good happens. It's also important, too, because you need to put lubrication there, because once you do take your hand away, that tissue is going to be rubbed on, and it needs lubrication as well. Women have a tendency to not talk about that, and they didn't talk about lubrication before, and they're somewhat embarrassed about using lubrication. Oh, my partner doesn't think I'm excited enough, and that's when I use the lubrication. It's like cheating or having been a failure. Absolutely not. As we age, normal changes occur to the vulva and the vagina that make you need lubrication, make you need to protect that tissue before insertion or even after intercourse. So it's real important to talk about these topics and the role of the vulva in addition to the role of the vagina, as well as your psychological and emotional standpoint when it comes to intercourse.
This is all great to know, and I think there are things that a lot of people don't know. Is there anything else that you would want listeners to know about the vulva?
Women will suffer with itching, scratching, burning for a long time, and they won't tell anybody. And then, oh my goodness, ladies, you love to go to town down there with a harsh antibiotic soap and a big old scratchy washcloth. And that is just bad for the vulva. We always want to use softer, moisturizing soaps down there, nothing with any kind of flavoring or other perfumes. And then you also mostly just need to use your fingers or hands. We don't need to scrub the vulva with a washcloth or, oh my goodness, not a loofah by any means, right? We want to have soft touches, soft soaps for down there. If you do have irritation and it doesn't go away, see a provider. A lot of it isn't cancer. Vulvar cancer is actually very, very rare, but there are a lot of precancerous changes that we can actually make better and make your life better, because the vulva is so important for even sitting or walking. So if you have irritation, come see us. We'll get it taken care of sooner rather than later. Doesn't necessarily need surgery, usually a little biopsy, some creams, close follow-up. What I also like to say is that we as women kind of have this cycle of diaper rash cream. We start with diaper rash cream, we end with diaper rash cream. As we age, that area can be very sensitive to heat, rubbing, and things like that. So if you're going to go to the Disney parks all day long with your grandkids, you put a little A&D on the grandbaby and you put a little barrier cream like A&D ointment on your vulva. Keep it healthy. Keep that skin protected with a barrier protection like that.
What a great idea. Thank you so much, Dr. Seward, for being with us on Taboo Topics today. To understand this topic better, listeners can learn more about Dr. Seward and her work at orlandohealth.com.
Thank you for listening to Taboo Topics. If you enjoyed this episode, please show your support by sharing with a friend and leaving us a 5-star review. Subscribe today to be sure you never miss an episode. This show is produced and sponsored by the healthcare leaders at Orlando Health. To find a doctor, walk-in clinic, or emergency room near you, visit orlandohealth.com.